Hey everyone, I'm just getting back to you regarding your questions on precautions and contraindications, specifically related to Sue's video on Patsy, which I thought was fantastic. So I wanted to just spend a few minutes going through that with you all. First off, I want to point out that you're gonna have clients or students coming into your class with all kinds of diagnoses and limitations, contraindications is what we might call them if they're medically placed movements or activities that they shouldn't be doing. So the first thing I want to remind you all of is that the student needs to know their contraindications. It's really up to them to be responsible for following them. And certainly, you wouldn't be expected to know every contraindication or limitation that student might have. So hopefully that leaves you kind of off the hook a little bit as it relates to knowing all the ins and outs of what's going on with them. I appreciate Sta's example that he gave us about a student that he was able to do a one-on-one with and really talk through movement with them. So certainly if you have time to connect with that student and learn a little bit about what they have going on, then you could better cue and guide them. And that's what I'm going to focus this conversation on today. So as it relates with Patsy, and I believe she had a spinal fusion or rods put in their back, I think what's important to remember is these individuals have had conservative treatment to include therapy and exercise. And they've also lived with chronic pain. Surgeons don't usually jump right in and do surgery, but they try more conservative approaches. And until the individual has had chronic pain or pain that can't be relieved by any other method is when they'll go into surgery. Certainly that's because there's risks involved in surgery. And then, surgery is not a guarantee, especially with a spinal fusion. I find that those patients that have had back surgery before, they continue to have underlying limitations still and still have pain. So it's definitely not like the fix all. I know that Sue mentioned in the video for her client in particular, no twisting. And that is pretty common post spinal fusion. But some people might have specific limitations as it relates to bending. If you can picture post any surgery, they'll either fuse or I guess kind of weld the spinal bones together, the vertebrae that we talked about. And so they'll either weld them together or they'll put a rod in between to stabilize them. So the purpose of the surgery is to create some type of stability. But within the process of the surgery, there's going to be scar tissue that is laid down just as part of the surgical procedure. So you have to remember that there's some scar tissue restrictions there. And then there's also muscle instability or imbalances that result from dealing with chronic pain and having those muscles being cut for the surgery. So you're working with a lot of factors and you're not going to know, again, all the details. So moving gently is important and encouraging your client to listen to their body. And as Sue did, pain is not allowed. So move within the pain-free range, setting individual goals for themselves, just like we do for ourselves. The bending sometimes is painful for those with the rod. And so I would say limiting the either half lift forward folds if that's uncomfortable for them. And sometimes that might be focusing more on segmental movements versus more complex movements. That being said, I would encourage you to keep the movements fluid, because I find that those that have had chronic pain or back surgery gets stiff or stuck if holding a position for too long. Gentle, fluid movement seems to work the best. One of the things that I thought of as well as I was watching the video is the importance of intention and breath work for patients with chronic pain, because sometimes the objective is not to have the pain go away. They've tried all types of methods to make that happen and haven't had success. And so teaching them other strategies like breath and meditation that can help them move their mind away from the pain. Or maybe they're not physically getting away from the pain, but mentally and spiritually, they're getting away from the pain. So creating an environment that's happy, creating an environment that brings them internal peace will help them maybe not feel or focus on the pain. And that's likely something that most people with chronic pain lives with. It's part of their life. And so they're constantly remembering that pain. So think about the fact that that hour that you have with your student, just the environment that you create, your words, your encouragement, the joy that you bring to class can really be a powerful hour for them that they may not be able to experience that type of peace any other way. I wrote down some notes, so let me see if I missed anything. I would say people with chronic pain or back issues. I saw Stas's question about ankylosing spondylolisthesis, which is like a restriction, an inflammation of the spine, essentially, that can cause a fusion. It's a restriction, and so expect there to be very unique limitations to that restriction, whether it be a side bend or a forward fold. Expect there to be restrictions in their movement, and that would be perfectly normal. Well, let's see. Yeah, I think I covered everything. So if you all have more questions, let me know. But again, I just want to encourage you to not expect to know everything that's going on. And that's where you want to empower your students to listen, to enjoy your class, to make sure that it feels good for them. And that their pain doesn't get worse, because sometimes they may always have pain. So you may not expect no pain, but just that the movement that you're doing doesn't make the pain worse. As we've talked about before, always avoid sharp pain and a tinging or nerve type pain that usually is more of a zinger pain. Dull ache, stretching, is obviously normal for all of us. So hope this is helpful, and I hope you guys are doing well. And take care and talk to you soon.